And how does this impact your work with EngenderHealth? Perhaps it would be a good idea now to talk a little bit about what EngenderHealth is, so that we can understand how the Global Gag Rule impacted your work.
EngenderHealth works in the world's poorest communities to improve the quality of health care, to ensure the rights of the peoples in those communities to health care, and to help empower the people and build their capacity to strengthen and create systems for healthcare delivery that last. And because we work through these local organizations, the reach of our work, the extent of our work was limited, because the key local organizations that provide these services through who we work could no longer receive support from EngenderHealth for programs that were funded by the U.S. government.
And so the work that you were able to do then was restricted to the governmental institutions, and what?
So the work we did was restricted with working with the government institutions. But in many of these countries, the government institutions are incapable of meeting the health needs of their entire population. And so these local non-governmental organizations do partner with the public institutions to provide healthcare services to their people. And in some places, in fact, these organizations are the only ones that have health facilities. The government doesn't duplicate those services in places where these local organizations are working. And so in places where these organizations worked exclusively, the cuts meant cut in health services overall for the populations that they served.
Now, it sounds to me that as if not only did it cause a cut in services, but family planning, in maternal health care, in child health services, sounds pretty undemocratic, because it restricts free speech, and there's an inefficient use of our foreign assistance funds. I would think that the Congress, the members of our Congress, would be pretty unhappy with the Global Gag Rule. What have we heard from our U.S. representatives and our senators?
The gag rule didn't only restrict funding, U.S. government funding for those services. It restricted those organizations from using their own funding or funding from other sources other than the U.S. government to provide any services related to abortion. And there are U.S. congressmen and women who have been very, very upset by the gag rule. And in fact, last year, the congresswoman for New York, Nita Lowry, visited Ghana. And one of EngenderHealth board members, Dr. Afusu Ama, took her to see the effects of the gag rule on the Planned Parenthood Association of Ghana services. So they have been very concerned. They have been to the ground to see the negative effects of the gag rule. And I know and have talked and visited with Congresswoman Lowry that she's working very hard to try to get the gag rule lifted.
Didn't she hold
hearings in Congress?
Hearings that really revealed. And was the head of Planned Parenthood Association of Ghana not at the hearings?
They held hearings, and in fact did invite the president of the Planned Parenthood Association of Ghana to give testimony at those hearings, and other organizations that were affected around the world. And so there have been hearings in Congress, and this demonstrates the concern, the serious concern they have about the effects of the gag rule.
And they tried to lift it, but
they tried to lift it, but it was difficult under the current under the Bush administration to get that done. And therefore, one of the actions that we sincerely and do hope that the Obama administration will take in its first 100 days will be to lift this gag rule.
And this is all very interesting, but why should we here in Westchester County be very concerned about the Global Gag Rule?
I know that the people in Westchester County are concerned about the health of women and children around the world, and not just here in this county. And so I'm sure they will be appalled if they understood the negative effect that the gag rule is having on the health of women and children, and of people running the risk of being infected with HIV, AIDS, because they can't receive the services they want, they need, and because the organizations that can provide them these services have their funding assistance from the U.S. government cut.
So, okay, what can we do as private citizens that Nita Lowey and our very eminently pro-choice senators from New York, stuff that they haven't already tried?
I think they should continue to try. There is going to be a new administration, so we have the hopes that if we try again, we have a better chance of success with the new administration. We will urge all the people of Westchester to visit EngenderHealth website, EngenderHealth.org, and sign a petition on our website that we're appealing to the new administration to leave the gag rule. But we'll also appeal to them to continue to make calls to their Congress people, to their senators, not just here in Westchester, not just in New York, but around the country, to let them know, let them hear from them how they feel about the negative effects of the gag rule on the lives and health of women and children around the world.
And so you're saying that if we go to the EngenderHealth website, there will be right there an obvious link that so that they can sign a petition to urge the president to repeal the Global Gag Rule?
Yes. Again, the website address is www.engenderhealth.org.
Excellent. And if we go to the website, we sign the petition, and if I should say when the president repeals the Global Gag Rule, what changes will we see? Will these clinics reopen? What can we hope for in the near future and a little bit longer?
I was in Tanzania in November during the election. And there was great excitement and expectation. I visited one of the Family Planning Association clinics to see how they were doing. We had been supporting these clinics before the gag rule was reinstated. And they really are anxiously waiting, expecting this to be lifted so that funding can be reinstated, but much more so that organizations like ours can resume the support we provided to them in building their capacity in order for them to be able to meet the needs of their communities.
So all over Tanzania, you're saying that people in family planning services are aware of the politics of the United States. The Global Gag Rule is likely to quietly disappear under President Obama?
Definitely, because the effect of the gag rule has been so widespread. Clinics have closed, programs have closed, people's lives have been affected. And of course, the people needed to understand why those clinics were closing, so they know why those clinics have closed. They know it's because of the gag rule. And so they are anxiously expecting the gag rule to be lifted so that funding to these organizations can resume and so that these services could be restarted or expanded.